Hello, everybody, and welcome to another episode of an experiment called Life with Alex Mackenzie. That is me. As always, we are brought to you by Punchline Nutrition. Go check out NeuroBoost. It is a nootropic. It helps your brain work better. I take it before I go on stage. I take it before I do these podcasts, do any writing. We don't guarantee it will make you smart, but it will make you less dumb. So go check out punchlinenutrition.com. Check out NeuroBoost. And we have the Hunger for Laughs comedy tour is on sale now. So you're going to love that. Three of my funniest friends and me traveling around doing jokes, raising money for charity. So go to www.hungerforlaughs.com and get your tickets. Now, I am very excited. Today's guest, I'm hopefully going to learn a lot from, and you guys probably will too. So please welcome Dr. William Moyal. William, thanks for joining us.
Thank you, Alex.
Do you go by
Appreciate it.
William or can you go by Will?
William, Will
You know
I
what?
am.
Yeah, Will, I am. You know, it's actually funny. My legal name is William. So I didn't even find this out till I was in kindergarten and they did
Oh, wow.
attendance because I just went by Alex my whole life. But then, like on my birth certificate, everything is
Uh-huh.
William. So when I was enrolled in school, they are just calling, they're like, William,
You
William. And
looked
I'm like,
around.
yeah.
Who's calling?
And W at the very end of the list. So I'm like the only one who hasn't been called. And I'm like, I don't know, my name hasn't been called. So that was fun. So anyway, Will, you're a chiropractor, and how
Right.
long you been doing chiropractic?
I've been in practice 40 years. Obviously, prior to that, went to school. While I was in school, I was very privileged to study under some of the best physicians in the world in medicine, chiropractic, osteopathy, and learn from them. And as a result of that, plus working with professional athletes, Olympic athletes, and we just did a count. We have had patients from 123 countries to date.
Right.
Um, I can tell you that back pain is universal, not
Yeah.
just United States. It's all over the world. Similar symptoms, similar problems, and with the right application solution, they get similar results. And so I took all that experience over the last 40 years and created what I call the proven three-step protocol,
Yeah.
which is geared towards figuring out people that have gone to other offices, sometimes up to 10, 12 different offices without results. And then instead of treating symptoms, actually discovering what the heck was going on
Right.
and then developing a plan of action that actually got them solutions.
Right. Yeah. Because it does seem like with most back problems. So like my brother got back surgery. I forget what it was. One of his discs. He had to get like is it discectomy? Is that what they do? Is that what they call
Yeah,
it?
it depends on how intense.
Yeah. So they had to like trim part of the disc off because I guess it was pushing on the nerves or something. And he was good for, I mean, it was a terrible recovery. It took him 6 months to a year to recover. And he was good for about 2 years, but just in the last 3 months, back again. And they're like, oh, I think we need to do surgery again.
Well, I would explore what's called spinal decompression.
Right.
And let me tell you why. The disc is like a sponge. As long as it's nice and wet and fluffed up, full of water, you can mold it and do whatever you need. So the body can move and twist and all that.
Right.
When you have injury to the disc, it's like a tire losing air. It's going to deflate. And the
Yeah.
closer it gets to the ground, the harder it is to drive. In the body, the harder it is to move and toss and turn and bend and sit and stand. And so as the disc continues to break down, it loses that water. Now, if you cut parts of the disc away, you may have trimmed it away from the nerve, but you just took away a portion of that sponge that can never refill again.
Right.
So,
So yeah, just a band-aid on the problem.
right. And what's interesting is when I went to school, we were taught there's only two solutions. One is surgery,
Yeah.
or the other is that eventually the disc will collapse and the bones will fuse together.
So that's what one of the suggestions was for him to fuse his back.
Right.
They're like, we can fuse it for you.
You can fuse it, but he's going to lose mobility. And then once you do that, the other segments above that are going to have to work harder.
Right.
and then they'll break down. And then when it gets a two or three in one level, it'll jump to the neck,
Oh, wow.
and they'll start having problems there. So in 2005, I was exposed to something called spinal decompression. And at first, I'm like, ah, bunch, got to be garbage. Because in school, well, we didn't know about it back then.
Right. Yeah, yeah.
And so I poo pooed it for many months. And then over a period of about 6, 8 months, it kept coming up like at least a dozen times. And one day I just looked up and said, okay, God, I guess you're trying to send me a message. Maybe
Yeah.
it's time to listen. And as I explored it, I came across a study by three well known neurosurgeons. And one of the lines said that the disc itself contains a significant mechanism for self repair.
Okay.
And all of a sudden, I'm like, oh my God, cell discs are made of cells. Cells can heal.
Right.
Like you shave, you cut yourself 3, 4 days later, it's healed. You
Right.
stop bleeding. And so, just like us as human beings, what do cells need? They need water, oxygen, nutrition, blood supply, get rid of waste products. And then we need sleep, obviously, and rest,
Right.
sunshine, laughter, all those things that are all natural so that we can function to the best of our ability.
Right.
And that became the course and change in direction in my profession, in my career. I was already all natural. I never prescribed drugs or any of that under my license. I can't anyway. But I always found ways of how do we treat these athletes that are injured and get them back to and on the field as quickly as possible. And it was all about biomechanics
Right.
and functional biomechanics and understanding that, for example, you take a quarterback in football. Well, he's going to do certain movements. You see certain injuries. You can start to deduce that there's a pattern because of the repetitive motions that he does,
Right.
that certain injuries manifest. So the other beauty is that you have the other side to compare to, normal
Okay.
versus abnormal. And
Right.
now you see what's changed and you can start to restore those functions.
And what
Other
does
quarter,
is spinal decompression, is that akin to like seen those like inversion tables? Like does that do it?
no, no, that's
Okay.
more just pure traction. And with inversion tables, if you're healthy, they're not bad. But if you have a disc issue, the problem is that it takes from zero to your whole body weight, and you can actually tear the disc
Okay.
further. Now,
Because I
but
actually hurt my back worse on one of those
yes,
inversion tables a while ago. I had like my buddy had one, and I've got a bad back. I got sciatica down my left leg.
okay,
And I went on it, and he warned me. He's like, "Don't go all the way upside down." He's like,
correct.
"Put it on one and just go
Yeah,
lightly." And I was like,
yeah.
"Nah, dude, like I'm going all the way, like just a fool." And I did, and it was like fine. Like it didn't hurt until I tried to get out of it. And then when I would like came
And
back
as you
out of it,
reload,
my back was like seized right up. And I
yeah,
was like, "Oh man, I don't know if I can make it up the stairs." Like,
yeah, as you started to reload the spine, it just really kicked in.
yeah.
Um, You asked about spinal decompression. It's actually funny because you just told me you're in Canada. It was developed by Dr. Alan Dyer, who was the Minister of Health for Canada
Okay.
back in the 90s.
Yeah.
And what they were doing is trying to figure out the difference between decompression versus traction for disc issues because they found that,
Can you explain traction a little bit? Like when you say
yeah,
traction,
traction is just basically it's a pulling effect,
yeah,
trying to separate the bones of the joints
right,
because the muscles are contracted. And eventually, the goal is that the muscles will start to give way
right.
and release the contracture.
Okay,
Okay. So, for muscle contracture, things like that, not a problem. For disc, however, when you take away that protective mechanism, you can actually pull on the disc so much that you tear it further.
right.
So that would be a negative effect.
Yeah, yeah.
So, they had volunteers, they stuck them with needles into the disc. Not, I'm sure it was not pleasant because they were big needles and they had to measure the pressure differential. And what they found is that when they could create a negative 100 to negative 160 millimeters mercury pressure, that this vacuum effect took place. It started to suck the disc back into the center where it belonged. And that over time, it allowed the outer fibers to actually heal.
Okay.
And so they started to get amazing results.
So is that
Um,
like the disc will physically move between the vertebrae? Like, is that, do you hear people say like a slipped disc and like,
think of it like a donut, like a jelly donut. You
yeah,
press on it, the jelly pops out.
okay,
Okay. But in this case, using negative pressure, you can actually suck the jelly back into the center, allowing the outside to start to heal. Because as long as that jelly is out, the outer fibers can't meet together because something's blocking it.
right.
But
Okay.
when you remove that, now they can come back and start to adhere to themselves and heal. And the other beauty of that decompression creates a very gentle, like an accordion effect.
Yeah.
And so it sucks water, nutrition, oxygen, blood supply into the disc. And then as you release it, pushes out the waste and the toxins.
Okay.
So it's like going to the gym and lifting weights.
Yeah.
As you pump, the muscles get bigger, they get engorged with blood, brings in more nutrition, and you're kind of tearing down tissues.
Yeah.
And if you use a lot of weight, you're going to get bigger muscles. If you use lighter weight, you're going to get more definition.
Right.
So we want to be somewhere in between that, challenging the disc, but at the same time, we're really going after bringing water, oxygen, nutrition, blood supply back into the disc. Because no matter where it is, where you have an injury, the more blood you get to that area, the faster it's going to heal and the
Yeah.
better
What
it's
is
going
it that they do with the where they put the blood in a centrifuge? What's that, you know?
to. PRP?
Yeah, PRP. That's is a PRP, right? Yeah.
Yeah.
Do they do that with backs? Is that a thing?
They can. The problem is that they'll inject it, even with stem cells.
Yeah.
Okay. Let's take it for example. I'm stepping on your foot. I'm putting pressure on it. I
Yeah.
can inject you with PRP or stem cells, and you might have great tissues that get rid of the inflammation and all that. The problem is you still have me stepping on your foot.
Right.
Now, wouldn't it be better if you took me off your foot and then injected that?
Right.
Okay. So in this case of a disc, for example, if you just inject it, but the disc is collapsed, you're going to rebuild a collapsed disc.
Right. So
Whereas if you use,
where do most people go wrong getting like is it your posture? Is it I mean it's gonna be different for everybody.
yeah, it can be genetic. I mean, there are people in Russia that are 80, 90, 100 years old, have multiple discs, never had a single day of pain.
Right.
And then I had a couple of years ago, I had a 15-year-old with 5 herniated discs in his lower back.
Oh my God.
15. Now he does crew, he rows,
Yeah.
doesn't lift heavy weights, none of that. So it shouldn't have done that. But I also know his mom and dad both have back issues. So it's probably
Okay, right.
genetic weakness.
And with
So
the genetic
posture,
weakness, is it like something on a cellular level that's allowing their disc to break down faster? So
probably, yeah,
yeah,
probably we not feeding or there's some kind of mechanism altering the function of the disc and being fed what it needs so that
right.
it can function properly.
When you have someone come in, what is the first thing you look for?
Um, well, through this three-step process, I act like a detective.
Yeah.
I listen to what they have to say, but I let the body tell me what's really going on. So there's certain things that I check, like what's called the psoas muscle.
Okay.
Very often, people, for example, will, do you feel stiff when you wake up in the morning? Well, yeah. How long does it last? Well, 10, 15 minutes, half an hour. Is it better after a shower? Oh, yeah, it's great. So I know that that's part of it. The psoas muscle is also very common with scoliosis.
Okay.
People that get diagnosed with that, okay, great, you have it, but what's causing it?
Right.
Okay. I also know from experience in 40 years that when the psoas is contracted, it also has a tendency to create torque on the spine, and torque and rotational forces are the worst enemy to a disc. It tears it microscopically until
Right.
eventually it becomes a big tear and the disc escapes through a herniation.
Right.
Okay.
Okay.
So Also, herniations have three different presentations. Because a lot of times, especially in the States, a lot of the insurance companies ask the radiologists to stop using the term herniation because it sounded horrible. So
Right.
they came up with terms protrusion, extrusion, sequestration. Protrusion is a portion of the disc that's popping out. And extrusion is further, and it's almost like there's a small stalk now, and the bulk of it is outside the disc.
Right.
And if it blows, you're going to surgery. I mean, there's nothing else that can be done. And then sequestration, a sequestered disc, part of the disc actually broke off.
Oh, wow.
Okay. It's free floating. And you and I could be talking right now, and you just soiled yourself and didn't even know.
Really?
You lose control of bowels and
Yeah.
bladder, and sometimes foot drop, and then you fall for what apparently is no reason, but that's the
Yeah.
reason.
So that was
Those
like,
those are complicated cases and more dangerous that they need to be shipped off to emergency room and eventually surgery as soon as possible.
right. Yeah, that happened to my dog. Like my dog got really bad arthritis in his hips, and then they said that they're like he's gonna get nerve damage, and then he lost control of
Yeah.
his bowels, and he would, yeah,
Yep.
just oil himself all the time.
Yep. So
Yeah, that's wild. What is
happens.
are all back issues then disc issues? Is that always the case?
No, no, it can be either a muscular issue,
Yeah.
overtraining, which eventually the problem is, for example, somebody wants to become a bodybuilder, but they're 5'4"
Right.
and 120 pounds, and they want to be this big dude or woman.
Yeah.
If you try to outbuild what your body was designed for, you're putting more stress on the joints, on the bones, on the muscles, tendons, ligaments. They won't be able to withstand that pressure. So
Right.
it gives way. Okay. And this is one of the problems we see, especially with younger kids now in high school. They want to bulk up and go crazy. They're not even fully developed yet.
Right.
So they're actually hurting themselves, but it won't show up probably for another 15 to 20, 30 years.
Okay.
They're in their 40s and 50s. That's when everything's going to hit the fan. And then all
Right.
of a sudden it's like, but I don't understand. I've been healthy all this time, and all of a sudden I'm in pain.
Right.
And so years ago, I developed a theory called the snowflake theory.
Okay.
Snowflake by itself weighs nothing, but eventually one more weigh nothing snowflake collapses a branch of the roof because
Right.
it's that accumulation over time.
Right.
Okay. And so a lot of the athletes that I've taken care of over the years and retired and still come in, I often we joke around and I said, would you let your kids do what you did? Oh, hell no. There's no way because I'm paying the price now. And if I had known, I never would have worked out and pushed the weights that hard.
Right.
There's wear and tear. It's
Yeah.
no different than using a pickup truck and you keep loading it, overloading it. Eventually, something's going to give.
Right. But there's got to be a balancing point of where weights are beneficial, right? For
Absolutely.
like,
Yeah.
because I do find I go to the gym regularly,
Yeah.
and like my back pain is never a zero. Like it's not like some days it's good, some days it's bad, but it's never zero. And I do find when I'm training specifically legs, it helps my back. Like I
Absolutely.
I notice doing I'm probably just even getting like the motion in your hips moving, you know?
Well, it's also, you know, depending on how you're back and what's involved, the compensation is going to be your front muscle, your quads, and your hamstrings.
Right.
So if they stay toned, you have better support of
Right.
the overall mechanism. But that's a two-edged sword because when you work out, you release endorphins, which kills pain.
Okay.
So a lot of times, bodybuilders, man, when I go to the gym, I feel so much better. I can't wait to go to the gym. And so it took me a couple of years to figure out this question. What happens if you don't go to the gym? Oh, I feel like crap.
Right.
I'm in so much pain. It's like, ding, ding, that tells me you're injured. Well, what do you mean? Well, if you rest, shouldn't you feel better because you're giving your body a chance to recuperate?
Mm-hmm.
And so if you feel worse, that means that there's an injury. But now, because you're not pumping adrenaline and endorphins, your body finally has a chance to assess what's going on. And it's going on to fix it, which is going to create swelling, to inundate that area that's injured with as much fluid and nutrition as possible so that it can start to heal. Problem is, it feels stiff and achy and painful.
Yeah, the stiffness is the biggest one I notice.
Yeah.
I just feel very stiff and it's yeah.
No, but there has to be a balance with muscle tone because if we look at older people, their legs disappear, they become like pencils.
I saw
And
it like
then,
some study that was that a correlation between like quad strength and mortality,
yes.
right? Like the people once you start losing your quad strength, it's like you're closer to dying. Like, it's
Yeah,
pretty
because
awesome.
you end up when you walk, you're standing or walking with knees bent to try
Right,
to compensate so that you don't fall on your face. Because if the legs can't hold your body and you got a big beer belly, you're going to fall forward.
right,
And so the body, in its own infinite wisdom, figures out a way to compensate for that. But then you lose balance, and then that's another biggie as people get older: the fear of falling, breaking their hips.
right. Yeah,
You know? And unfortunately, you mentioned mortality. Most people that fall, only 25% of those people ever go home. The
really.
rest either end up in hospice or nursing homes or pass away.
Yeah, I heard that like falling is like one of the major causes. It's pretty wild.
Yeah.
What is real, I don't know if it's a real buzzword for it, but it keeps coming up ever on my feed and I keep seeing it, but that anterior pelvic tilt.
This use part of it is going to be the psoas because the psoas is in front of the spine, goes into the each side of the hip joint. And so when it contracts, it pulls the pelvis forward and it's going to give like women like to brag that they have a nice curve,
Yeah,
but it that can happen with men too when those muscles contract, which puts more stress on the sacrum and on the last disc as well as the hips.
yeah,
So now the pelvis, the hip joints, all that get locked in, and it's more difficult. And if you don't stretch, you feel like, man, I'm like 90 years old, even though I'm 30 or
yeah. Well,
40 or
I
50.
definitely have that. I got a big old from hockey. They would say hockey player. They're like, oh, you got a hockey
Yep.
butt. But I know it like it is like it's like my stomach sticks out, my ass sticks out the
Yep.
other way, and it's like a bad. But then I
It's
don't know. I do like do you can you just stretch that out? Like you just stretch and it's gonna go back
You
to
can,
normal?
but you
Like
have to also find out if it's not because of a disc issue in that case.
right.
Okay.
But like
You
to get
mentioned
that
hockey.
pelvis
So,
back up, like is it just the stretching alone will do it, or do you have to do like do you have to
well,
strengthen your muscles in the back to like pull it back down? Like your front, I always feel like in the
it,
front of my hips are tight.
it would be nice if it was that easy, that it's just position.
Right,
We just move it back. But what's the mechanism causing it to do that for your body to protect itself?
right.
That's what has to be figured out because it's easy to say, well, if I walk like this, I'll just make sure I walk like this. Well, that might
Yeah,
last 5 minutes till your body gets tired or in pain. Then it's going to adapt to a position that creates less pain and less discomfort.
yeah. And
So,
is it the longer that people have that posture, the harder it is to get them out of it, I guess?
yeah, because it's like training. You have to break that pattern and then rebuild the pattern. So the
Right.
longer it exists, the more work there is to do. Um, you mentioned hockey. There have been some pretty big names that have come with herniated disc and that now are better, never had surgery, like Sergei Gonchar, um,
Okay, nice.
Sergei Fedorov,
Yeah. Awesome.
Ilya
Couple Russian.
Kovalchuk.
Yeah.
Yeah,
Dude, I love the Russians too. They're my favorite. Like Ovechkin's like my favorite player
yeah,
ever. Yeah.
yeah.
Dude, that's crazy. And then so it's just through exercise, I guess. And how do you tell? Do you
It's
like do scans on people? Do you do a
Yeah, we do.
X-ray?
We send them out for MRIs to figure out exactly what's going on and where it's happening and
Yeah.
the intensity of it. Because you want to be as specific as possible so you can get the best results and outcome. You don't want to guess. You want to know
Right.
exactly what's going on so we know exactly how to treat it using the right angles, the right pull weights, all those things. They're all factors in that. And
Right.
so um, when people come in, One, going back, we need, is it a muscular problem? Is it a joint issue or is it a disc issue?
Right.
And all those three things need to be differentiated. Whereas in most traditional office, you go in, you have pain. Oh, where does it hurt? Right there. Oh, yeah. Well, let me give you this. They give
Right.
them a script or a shot. Well, that's not going to fix the problem. It's
Right.
like having a flat tire and you go put armor all on it, make the tire look shiny.
Yeah, if there's a hole in
Fix
it,
it.
you just pump it up and then drive down the road and it's
Right.
flat again.
Yeah.
Yeah, that seems to be the problem. Like, I don't know, I kind of we went over it before, but it does seem like it is. You can get these surgeries, but you're going to be back in the same spot if you don't fix the problem that caused it in the
Listen,
first
Tiger
place.
Woods, perfect example. He can go anywhere he wants. He's got the money. He's had six surgeries.
Yeah,
How many more can you have? And unfortunately, I said this a few years ago. I'm like, this guy's time's limited because you can only do so much damage already and then go in and add more damage trying to fix the damage, but it creates scar tissue and more damage to the tissues. And
yeah,
so the body can only handle so much for so long before it says, I've had it. Kind of like people getting divorces. You know, they bicker, they do fight against each other, and one day is like, you know what, I've had it. I
yeah,
want out.
yeah,
So
yeah,
it's really in a sense, it's the body's way of divorcing you
yeah,
or somebody because it's had enough because you're abusing it.
yeah. What are and where does chiropractic fall into this? Like, do you cracking?
It's no, you definitely don't want to do that if you've got herniated disc because putting too much pressure on the joints or surrounding joints could actually create more damage to the disc.
Okay,
And we've seen that when people are not trained in spinal decompression or not trained in disc problem discovery, they'll apply regular techniques and the person doesn't get better. Sometimes they get worse.
right,
And they're like, well, I don't know, just keep coming. No,
right.
no. You need to figure out, first of all, if you've got somebody that's not responding within 2 weeks, at least 30 to 40% improvement, you need to escalate the case, whether it's an x-ray or an MRI or a CT scan or something. You need to really be a detective and figure out what the heck is going on, why they're not responding. Because after 40 years, I can pretty much tell you, excuse me, when someone walks in the office, they tell me what they've got, whether I can help them or not,
Right.
and how long it should take me. And if I don't get that kind of response, I start getting a little concerned. Usually 10 days, 2 weeks is my window.
Yeah.
And if they're not responding at least 20, 30, 40% improvement, I'm like, you know what? I think we need to take another step here and send you out for an MRI or
Yeah.
a CAT scan or something because
Right.
I need to understand why you're not getting better.
Yeah.
You know? It's
And
it's like
how did
applying a formula. You know it works, but if it doesn't work, then something else is going off, and it can be either the formula or the people going home and not doing what you ask them to do, messing up the formula.
yeah, that's always got to be a harder thing as well, right? Trying to manage that. Like if people are actually doing it's like going to the physio, right? Like you go to the physiotherapist and they give you exercises and you're like, ah, you do them when you're there and then you never do them at home when you're supposed to or
Correct.
whatever. And yeah. What is what would you say the success rate is like of when you see someone like are do you believe that all back pain is fixable?
No,
No.
no. I mean, is every diet going to work for everybody? No.
Yeah.
Okay. Um, Success rate with decompression across the board is 86 to 92%.
Oh wow. That's great.
Surgery is about 47%.
Oh wow.
And each subsequent surgery drops. So it goes 47, 35, 18, and it keeps going down.
Right. And is that what made you opt for? Because I see your like non-surgical repairs. Can you?
Well, as far as it being a chiropractor, everything I do is no medications, no drugs, no shots, no nothing, no
Right.
surgery.
When
So
you were mentioning the cells and that with needing certain things, do you ever look at people's diets? Like, is diet a contributing factor?
absolutely. And one of the biggest things, no matter what injury, disc, sports, whatever, people don't drink enough water.
Right.
So if the tissues are not well hydrated, whether it's ligaments, tendons, muscles, disc, meniscus, whatever, they dry up, they break down.
And when you're injured, do you need more water? Like to for it to be able to repair?
You need more water and you also need more supplements
Right.
because your body's lacking and now it has to have an influx so that it can go to work to fix that.
Okay. How
So
many liters of water do you recommend people drink?
simple formula, you take your body weight,
Yeah.
divide it in half, add 25%. If you heavy workout, 30% on top of that. So someone weighs 200 pounds, 100 plus 25 would be 125 ounces.
Okay.
128 is a gallon. So
Yeah, yeah.
that's what they should be drinking. Now, if they're nowhere near that, they need to start off slow. Otherwise, they might as well move into the restroom, computer, everything, because
Yeah.
they'll be peeing
Well, that's my
everywhere.
favorite thing about being in this RV. Like I drink a ton of water. I drink like 4 liters
Good.
a day, I would say, at least. We go in liters, so I guess there's what, how many
Yeah.
ounces in a liter? Like
Uh, 500.
32, kind of, something like that.
Yeah. So
Something like
100,
that, I think,
somewhere
around
there.
there. Yeah, yeah. But yeah, I'm in here, like I have a bathroom with me. So you're just everywhere you go, you
Yeah.
have a bathroom. Because dude, I'm in the bathroom all day.
Yeah.
But
But
I
the other
love
thing too is sometimes people start over drinking because I say you need water. And there's two things that can happen. Number one, if you have a bucket full of holes, you can keep adding water, but it's going to escape.
right.
So if you have a disc issue, drinking more water is not necessarily going to fix the disc issue unless you're doing something to stimulate the disc.
Right.
That's number one. Second thing is they start drinking too much water. They get rid of electrolytes and now they start feeling tired and they can actually get more injured because the body doesn't have the right amount of things to keep it in check.
And is magnesium probably the biggest one?
Magnesium, or even getting some salt, Himalayan salt in the water, because
Yeah.
it's got like 83 different minerals.
Right.
So, yeah, I mean,
Yeah,
it tastes salty, but
I keep a bucket of salt. I salt all my food, like probably
yeah,
too much,
me
but
too.
I get my blood work done regularly and it seems fine. So,
But what kind of salt are you using?
oh, it's sea salt,
Okay, good.
but it's
Yeah,
like, oh, dude, it's cool. It's like I never know what to call it, but it's like it's not like it's so funny. I literally just put in a Tupperware in my
yeah,
there because I like pinching it. But it's like I don't know if you'll be able to see, but it's kind of like oh, probably not, but it's
yeah,
like grainy. Like
yeah. No, I see it. Yeah,
it's not like sand.
yeah,
It's like yeah, I don't know. It feels weighted,
yeah.
but it's not.
Right. The regular salt, sodium chloride, that's not great for blood pressure, heart, all that other stuff. But that type of thing, because of all the minerals, it
Right.
actually is good for the body.
Yeah, maybe that is why you're getting away with it. You're eating healthier salt, yeah. And I find that like you just you'll sweat it out if you have too much generally, right?
Yeah.
Like if you're drinking lots of water, you just sweat it out and it
Yeah.
seems to be okay.
Even with people say, oh, you take too many supplements. Well, if your body's going to take what it needs and get rid of the rest.
Yeah,
So,
that's what I find.
yeah.
Yeah, yeah. That was an old joke I wrote was like I'm terrible with money. I'm like I spend hundreds of dollars on vitamins. I'm literally pissing my money away.
Yeah.
Yeah.
That's what the MDs used to tell people. But
Yeah.
the problem is the quality of food these days is not what it should be. Therefore, you need to supplement.
Yeah. Yeah, you definitely notice it with there's this really good app. Have you ever heard of Yuka?
No.
You can look up it's like Yuka. It's the Yuka app and it's just got a barcode scanner and you can scan it and it'll tell you everything that's in that product and it gives it a score.
Okay.
And I was originally designed, I think, for beauty products
Okay.
like shampoo, conditioner, like makeup, because there were so many chemicals that were going into these things. So these people made this app to scan it. And it's great. Like it gives you a breakdown. It's like, hey, here's everything that's in there. And it shows you like green, yellow, red. It's like, hey, this is a
Right.
product. This is fine. This is like mild. This is bad. And you
Yeah.
click on it and it gives you like the chemical compound, the whole thing, like gives you like a little write up on what the long-term effects of this are or short-term or anything. Yeah.
Right.
But
Oh, that's great. I'll have
it
to look into that.
yeah, it's cool. It's too it's so funny. My buddy showed it to me. It seems too good to be true. I'm like, they're too nice. I'm like, they're not asking me for money. They're not
Right.
like, and they're like, we don't take money from any products. We don't do anything like that. Um, so I'm like, what's your business model here? How are you making
Yeah.
money? You just actually
That's
made like a
interesting.
good, wholesome app for helping people out?
Maybe.
Yeah.
Or
Yeah.
maybe unless they present some products later on.
Well, the one thing that they do is they do recommend you products, but they say they don't get money from those products. So they'll show you like if you're eating Doritos, they'll give a score on Doritos, and then they'll be like, here's a potato chip that scores higher. And they're like,
Right.
the old Dutch regular, it doesn't have these chemicals in it.
Well, that and there's been some videos circulating that when you put some of those like Doritos and Cheetos and all that under a microscope, oh
Y-
my goodness, the stuff that's crawling around.
Yeah.
So yeah.
Yeah, yeah. They got everything in there. What are anything like someone you've worked with where you've done something and the results were so good at like they really stuck with you, where you're like, oh, this is
Here's this is a funny one. About 38 years ago, I had a French guy came in, and at that time, I really didn't know about discs. But now looking back, he definitely had major disc issues.
right.
He was married to a Spanish woman from Spain, so already the Latin blood.
Yeah.
This poor guy comes in, he's leaned over, he's got a cane, he can't straighten out, he's in pain, and all she could think about is, he's cheating on me. That's why he doesn't want to have sex. He's cheating on me. That's what caused this.
Yeah.
I had to stop her and said, ma'am, when a man is in pain, the last thing he's thinking about is having sex.
Yeah.
So about a month and a half goes by. Now he's feeling good. He wants to be close to her. Now she comes in. She's swearing that he gave up the other woman. So that I'm like, oh my God, this guy's, no matter what he does, he's not going to win. Okay.
And
So
you're
I
over
don't know
here
what
like,
happened
hey,
to
what about
them.
my work? You know?
Yeah. It's just like amazing. But
Dude, that's funny. So that's just yeah.
I think the big one was Ilya Kovalchuk. He had several herniated discs. Four different doctors told him, you need to have surgery. He's like, I don't want surgery. I saw my teammates, no surgery for me.
Yeah, yeah.
And Fedorov,
How long ago was this?
11 years ago,
Okay. Yeah.
Fedorov sent him in, and we only had like 3.5 months to work because he was between seasons.
Yeah.
By the time we were done, he was ready to go back. He was strong as an ox, no problem.
Yeah.
Played another 10 years until he retired.
Yeah.
The last Olympic, Fedorov, Gonchar, and Kovalchuk with the three coaches for Russia.
Right.
The last Olympic, and it's cool because I all three of them are patient. Actually, Gonchar just came in last week,
Oh, really? That's awesome.
but he played another 10 years before he retired and never had surgery, nothing.
And what do the sessions look like? Like, is it like hour long? Like how long or an
Well, we
hour
do a
every
little
day
things.
or
Yeah, we do it a little different than most offices. Most offices will just put somebody on decompression and then maybe cold.
right.
We actually prep the body first, maybe do some stems, some muscle stimulation, some ultrasound. We have another machine called the Neuromed, which is almost like giving somebody a nerve block, but
Right.
no chemicals, no needles, nothing. It's a very souped up machine.
Yeah.
Knock out a lot of the tingling and numbness and all that. And then we'll put them on decompression. Then we'll ice it, and then we use cold laser. Cold laser is amazing. It's a red light type of therapy.
Yeah.
Increases circulation, decreases inflammation, it rejuvenates cells, and it eats up scar tissue.
Yeah.
So everything you want, and it acts like a magnet for blood. So it draws blood to that area. More blood, the more healing, the faster the healing, the better the healing.
Right.
So anything and everything that's out there that has been proven to work, and because we deal with professional and celebrities and whatever, I brought it into the office and I use it on everybody.
Yeah.
want them to get the best results possible.
Yeah, yeah. Dude, that's exciting, man. That's
It
really
is. It's
cool.
fun. It's
So
really
has it
fun.
been like you've probably seen like over your did 30-year career, is that right?
40
40-year career. All right. You look too young to have 40-year career,
starting,
man.
starting.
Over your 40-year career, like you've seen probably major changes in the game, eh?
Absolutely. Absolutely. I
Yeah.
mean, a lot of stuff that exists today, we had no even thought of.
And do you think it
Even
will
like,
keep improving like that? Like it'll just like in
I
40?
think so. I think so. But, the other side of it is you're also dealing with a system that's made of cells, that's made of bones, that's made of muscles. You can refine like a lot of the rehab and prehab
Yeah.
is fancy, but the reality is just because you're strengthening and doing all this stuff doesn't mean that you're putting any attention to the joint complex, which is
Right.
really where all the injuries come from.
Right.
So I see a lot of videos on Facebook, YouTube about no stretching. Forget the chiropractor, forget the physical therapy, forget the acupuncture, forget the yoga, do stretching. Well, that's
Yeah.
one phase.
Right.
Some people have so much damage that if they stretch, they'll actually injure themselves even worse.
Yeah, well, I've got two friends with back problems where that was the issue. Like they're
Yeah.
like, my buddy threw his back out trying to touch his toes. Like he was
Yeah.
like trying to stretch and he thought he was doing a favor, like, oh, I need to loosen my back up. It's stiff.
Sure.
And he went to stretch and he's like, dude, and it popped and it was like
Yeah.
he couldn't
Because
walk.
biomechanically, the joints were not stable.
Yeah,
You actually pushed them onto the other side.
right. I'll just a couple more questions. I'll get you out of here. But
Okay.
one I wanted to ask you about was what is this new surgery? I saw this that I follow hockey about Jack Eichel, so he plays for the Vegas Golden Knights. But he went and got a surgery in Germany where they're like sliding the whole they cut your whole old disc out and they slide like
Yeah, there's some, they do it here too,
okay.
where they put an artificial disc,
Yeah,
you can move and slide. Here's the problem with that. Your body has no awareness of it, so it has no awareness of where you are spatially.
right.
They stopped doing that when they were putting like almost like plastic discs
Yeah,
in.
exactly. Yeah.
People were falling and they realized, well, wait a second, there's no sensation, there's no sensory mechanism to tell the body where it is in space.
Right. So you have to
So it
learn
was
how to
unstable. And
rebalance yourself. Right. Because he seemed to be doing very well. Like, yeah, that's actually why he left. Well, not the only reason, but he got traded from Buffalo because Buffalo wouldn't
uh
let him go get that surgery.
right.
And Vegas was like, yeah, go ahead. Like, and,
Yeah, they do put some on top on the bottom of the top vertebra and then on the top of the lower vertebra. And then there's some mechanism that actually are like saucers.
okay.
So
And I heard recovery time for those can be like a month. Like, it can be really quick
yeah,
compared.
there's
I
a
mean, it's
lot of
always
stuff out there.
right.
It's how is it going to transition in a year, 3 years, 5 years, 10 years from now?
Right. And I mean, I guess surgery is always like last resort is ideally,
Yes.
right? Like, don't rush
Ideally,
because that's the
do
same.
anything and everything before,
Is there a
because
way
once
to
you do
tell between, because the other thing I've been told, like piriformis syndrome, have you heard of that?
piriformis, that's why I mentioned muscle, joint, or disc. Yeah,
Right.
piriformis syndrome. If the piriformis is too tight or too loose, it can affect the sciatic nerve, which
Yeah.
will then trigger sciatica.
Yeah. And then so you think it's a disc issue, but it's actually a muscle issue,
Could be, yeah.
right? Or, right.
Yeah.
Yeah. Yeah.
That's why you have to find someone that takes the time to really figure that out.
Right.
Okay. So, for example, that person maybe gets sent out for an MRI. There's nothing there.
Right.
Okay. It's not a disc issue. What the heck is it? But
Right.
if someone is more trained or understands those mechanics, then, I mean, I would look myself for piriformis, psoas, quadratus lumborum issues, all that, because they can also be trigger points that will reflect and refer pain down the leg, which will mimic a sciatica, but it's
Right.
not a true sciatica.
And when
So,
it is a muscle issue, then is it just working on strengthening that muscle? Like you just look for exercises specifically to
um,
that piriformis?
it can be because of weakness, but there might also be trigger points in that muscle, and those need to be released so that you get a longer resolution.
And how do you do that? Like with needles? Like you need acupuncture or something?
It could be acupuncture or it could be ultrasound, what I call combo
Yeah.
muscle stem with ultrasound, because
Okay.
that really hits the trigger points.
Yeah.
Um, there's also they do trigger point injections. They're okay.
Right.
But you do need to look at, are my muscles in tone and are they able to uphold my body weight?
Right.
Otherwise, you're constantly compensating and you're going to keep having more and more issues.
Yeah. Yeah. That's awesome.
Yeah.
Cool. Well, I will let you get out of here, Will. But one
Oh,
thing,
thank you.
like asking everyone, just a parting thing, and it's more just a life thing, is and I mean you could if it factor, that's great. Oh no, did I freeze?
No, you're on and off.
Oh no. Oh boy. How long's that been going on?
Last minute or so.
Okay, great. Well, that's a great time to end it. Okay, so last question, I guess, real quick, is what is something you used to believe to be true that you no longer do?
Wow, that's a good one.
Yeah.
Um, that all people are good
Okay.
and they have your best interests at heart,
Yeah.
but the reality is they have their own best interests at heart. That
Right.
doesn't mean that you have to shut off to everybody. You just one relationship was that way, doesn't mean the next one will be that way. You have to give everybody a chance to prove themselves or disprove themselves and yourself too to them.
Yeah, that's actually very interesting timing on that for me because I literally just had an experience less than a month ago with that, and then it made me question who I'm giving my time and my resources to,
Yeah.
And I'm like, because I used to be the guy where I just like, if anyone wanted to come along, I'm like, the more the merrier, And you just meet people and you're like, oh, this will
Right.
be great. Come with us. We'll hang out and this and that. Then you start realizing you're like, I don't think every person's a good person, but I don't like it because my favorite thing is people. And I really
Right.
carry a very positive view of people. Like I just have a
Yeah.
general positive view on the world. I think the world's great. I think people are amazing, but I do think I need to learn, like you're saying, like it's not, there are great people, but not everyone's great?
Yeah. And it's kind of sad that you and I are both type of people that like to open everything to people
Hmm.
and allow them to come in. And when they do something that's disappointing, it's like, wow, makes you question yourself. Like, thought I was a better judge of character.
Dude, you're literally
And
taking the words out of my mouth. Like this
so,
is so funny, man. Because I
yeah,
literally just said that I had I talked to my mom and to some of my friends, and I was like, man, like I don't think I'm a good judge of character. Like I thought this person was great, and then
yeah.
find out, and you're like, no, dude, and it's like, and then with multiple people, and you're like, man, I'm just like I'm naive, I guess, and yeah,
No, you're trusting. Not naive. It's just trusting, and it's part of. As we get older, we have a tendency to realize, I'm 67,
right,
so I realize that there's some things I really like, and there's other things I don't like and won't put up with.
right. Yeah, well, that's good to just start creating some boundaries and figuring out.
Yes, gotta have boundaries.
Yeah, awesome. Okay, well, Will, where can people go to find you? Where?
They can go. I mean, the best would be my website, Coral Way,
Yeah,
Coralway, disc, D like David, ISC,
yeah.
and then another C, ENTER
The
at
disc
.com.
coralwaydisccenter.com.
CoralWayDiscCenter.com. Yep.
Awesome, man. That's great, dude. I really appreciate all the knowledge and it's good chat. And just great talking to you, dude. You're a great guy.
My pleasure. Thank you.
Awesome. Okay, well,
Yeah.
take care.
All right. You too.